The CYGNET study is a longitudinal or long-term study of a group of girls recruited from Kaiser in the Bay Area, specifically from the Marin County San Rafael facility, San Francisco, and Oakland. And we started studying these girls at age 6 to 8, and we're now in our 8th year. And the study's purpose is to evaluate and determine the timing of puberty, whether puberty is happening earlier in girls than in the past, and if so, what some of the environmental causes might be. And the reason that this is a breast cancer study is because long-term data has shown that the younger you are at your first menstruation or your first period, the higher your risk of breast cancer. So zero breast cancer has been a fundamental part of our collaborative approach since we started. We have basic scientists, we have clinicians like myself, and we have our community outreach core, which is our zero breast cancer. We couldn't have done this study without zero breast cancer. I grew up in Marin County, and I've seen so many women in our community suffer from breast cancer, including women my age. And I know the good work that Zero Breast Cancer does. So to be honored by them when I feel like they've been helping us the whole way through the study it's been a real pleasure.
Well, I've been involved in CYGNET since the design of the program and the grant application, and I had just done a few analyses of age at menarche, and so it was a nice lead-in into this project. And my main expertise is environmental exposures. I'm the lead on the environmental exposure component. We think there are different susceptible periods during the lifespan. And I studied pregnancy originally, which is a very susceptible period, we think. And puberty is likely to be another one. There's rapid changes going on as the girls develop and reach reproductive maturation. So potentially an exposure might have more effect at that point. Yeah, I just want to thank Zero Breast Cancer for this honor, and I'm sorry I won't be able to actually be at the dinner to meet more people and to be with my colleagues. And I'd also like to thank my colleagues and collaborators. It's been a great group to work with. And really want to thank the girls and their parents who participated and keep coming every year and are willing to tell us about these private, personal things. And we feel some responsibility to them in doing quality research.
As a part of the CYGNET team, as a member of the CYGNET team, I bring a very specific perspective. I was trained as an adolescent psychologist and have seen adolescents in clinic, and so am intimately familiar with what's going on during adolescence and some of the challenges that girls face. As someone who's interested in stress, I think it's important to start at the origins of stress and really look at early life events and how they may influence longer-term trajectories of risk. The relationships that have been established between the institutions like Kaiser and UCSF and UC Berkeley and Zero Breast Cancer have been incredibly unique in terms of the level of collaboration that these organizations have engaged in to produce better research. It's an honor to be nominated for the Community Breast Cancer Research Award, largely because these relationships don't happen that often, where researchers who are working at large institutions can formally engage in relationships with community-based members, and we work really, really hard to make it happen. And so to have it officially recognized it's a huge deal.